computer is picking up a strange signal. Here, sir, you better take a look at it.
Hello dear listeners, and welcome to episode 91 of Life Through a Prism with your host Rob Tierney. In this episode we're going to look at an article from qnews.com.au entitled Medicare Funding Considered for Gender-Affirming Surgery by Jordan Hurst, dated 10th of August 2025. A federal government committee has acknowledged the unmet need for improved access to gender-affirming surgeries, as it considers a landmark proposal to fund them on Medicare. The Medical Services Advisory Committee, or MSAC, advises the Federal Health Minister on where to allocate public funding on the Medicare benefits schedule. MSAC has considered an application to subsidise the cost of gender-affirming surgeries and improve access and mental health outcomes for gender-diverse folk across Australia. The Australian Society of Plastic Surgeons, ASPS, has led the application. It proposes Medicare funding for 30 procedures for adults, including feminising and masculinising, top surgery, bottom surgery, as well as facial and voice surgery. If approved, patients could have up to 75% of costs covered by Medicare. In its consideration published in July, the MSAC agreed there was, quote, an unmet clinical need for gender-affirming surgeries for people with gender incongruence, end quote. But MSAC said more consultation is needed before the proposal for Medicare coverage would be approved. The committee asked the Health Department to gather more information, including on longer-term outcomes. The MSAC considered that the identified evidence appeared to support superior clinical outcomes in the short term, it said. Further assessment of the comparative safety and clinical effectiveness of gender-affirming surgeries is required before the application can progress to economic and financial analysis. High out-of-pocket costs for gender-affirming care. The MSAC's consideration comes after years of lobbying by transgender advocates for improved access to gender-affirming surgery. One petition to the Federal Parliament in 2021 attracted over 148,000 signatures calling for coverage on Medicare. Despite research showing mental health and quality of life benefits of gender-affirming surgery, it's out of reach of many trans folk because of high out-of-pocket costs and no Medicare subsidies, the petition has told the federal government. The ASPS says gender-affirming procedures are performed in Australia now, but availability is low, costs are high, and waiting lists are long. Groups including the Royal Australian College of Surgeons and the Australian Medical Association's Australian Peak Medical Body have supported the Medicare application. Last year, the AMA called for urgent improvements to gender-affirming care access more broadly and support for the doctors who provide it. In a position statement, the AMA called on the federal government to urgently enhance access to gender-affirming treatments, including through the Pharmaceutical Benefits Scheme and Medicare Benefit Schedule, because of the positive health outcomes they give trans and gender-diverse Aussies. What are your thoughts on this subject? We'd love to hear them. Let's have a conversation. Till next time, take care and bye for now.